I did want to ask about anal cancer screening because I think probably most primary care docs are less familiar with that, and talking about doing digital rectal exams and anal paps. Are you doing those in the office? Like who's doing those? Should primary cares be doing those if their patient's not seeing an HIV specialist yearly?
Sure. Yeah, I've been doing anal pap screening. I did a lot of it before coming to Penn State Hershey. The issue sometimes I worry is that the costs of the testing for patients prior. But I think a lot of things have swayed in the last couple of years. Last year at Croy, the Anchor study kind of gave out some preliminary results looking at anal cancer screening. So I'm trying to remember what the Anchor study stands for, but I think it's like anal cancer, high-grade squamous intraepithelial lesions. A mouthful.
Oh, that's great.
It's practically a cardiology trial. That's not bad.
Yeah. But what they were looking at was they were screening patients over the age of 35. They had both men and women, trans female, trans males as well. And they were looking through and seeing if a patient tested positive for a high-grade lesion, should they just take it out or should they just monitor it? And the study actually closed early. It was between 15 different sites overall in the U.S., and just because there was clear benefit necessarily from it. So it's something that I've been doing a lot more in my patient practice and having that discussion overall. So, and I've caught a lot of high-grade lesions, and then after that, really tying them for the endoscopy or colorectal to take a look to make sure if there's any suspicious lesions. And then after that, follow up with colorectal.
And any resources for like people? I don't think I did not learn how to do that. I know I did not learn how to do that in training. So what resources are there for people if they have to learn how to do anal pap
so there's there's a wonderful iteration and stuff from like some of the health departments overall. Mm-hmm. It sounds more difficult than it is. It's just a brush, actually. Overall, and you're trying to get around the Z line and putting pressure as you go in, put pressure as you go in, and then just spin as you go out. But you can Google it. There's many different things in PDF.
And patients can't self-swab for that. Like they
That's one where we don't recommend necessarily self-swabbing. And then sometimes also thinking, rectal exam, digital exam, just making sure you're not missing the lesion from the brush. So those are things I've had discussions with my patients and recognized that overall, they may not want to do that at the moment, or I don't save it for the first visit. It might be stuff as we develop rapport.
Okay, great.
And along those lines for cervical cancer screening, I know things are a little bit different for patients living with HIV. You don't have to go too granular, but like any big differences between anything that you would do differently for someone who is living with HIV than someone who is not?
Yeah, so I think, if I remember correctly from the primary care guidelines, usually age 65, you would necessarily stop for cervical cancer screening in patients not living with HIV. In persons living with HIV, actually, it goes on past that. So overall, also depends. We try to do it within the first time of diagnosis, but still go by the guidelines. So nothing earlier than necessarily 21.